All right. Hello, everybody. Welcome back. Today's session is about mental health and the impacts on the body and mind of our mental health. So, we'll actually be taking a look and diving into the ACEs study today, the Adverse Childhood Experiences study. My name is Tova Fairshot. I am an education consultant across Washington State, and my company is Innovative Behavioral Consulting. Today, we are going to be understanding the impact of trauma on the body, on the mind, on behavior. We're going to analyze data and we'll look specifically at marginalized communities and mental health struggles through the lens of the ACEs study. We'll understand a holistic definition of health and how it is related to improving that mental, physical, and social wellness. We're going to reflect on an activity to engage in interventions with the youth through a trauma-informed lens. And finally, we'll determine interventions to support youth with varying challenges of mental health. Trauma Aware Schools states that traumatic stress can arise from a variety of sources: bullying at school, dramatic weather events, school shootings, even the day-to-day exposure to events such as divorce or homelessness. Children and adults can be affected by traumatic stress. Having the tools to manage traumatic stress empowers the members of the school community. So that's why you're here today and what we're learning about today. We're going to dive into the ACEs study. So I'm going to give a little bit of a background, and ACEs stands for Adverse Childhood Experiences. This study in particular was conducted by Kaiser Permanente in partnership with the CDC between the years of 1995 and 1997. There were 17,000 people that participated, and 2/3 of the people that did participate acknowledged that they had adverse childhood events. So out of the 17,000 participants, 2/3 of them acknowledged that they had adverse childhood events. This included verbal and/or physical abuse, sexual abuse, emotional and/or physical neglect, family separation or divorce, domestic violence, substance abuse in the household, mental illness in the household, imprisonment of an immediate family member. So these were the 10 parts, the 10 areas that the ACEs study looked at and surveyed. And this is exactly what the ACEs study looks like. This is the questionnaire. You have access to this in the resources that I have provided on my personal website, www.innovativebehaviors.org. If you click on the resources tab up at the top of the homepage, scroll down the resources page a little bit and you'll see a button that says link to resources. And this you will find under day 3. And again, there's only 10 questions. Once an individual responded to these questions, then their ACEs score was how many yeses were added up. 1, 2, 3, all the way up to 10. So we are going to take some time now for you to complete the ACEs survey. Again, this is found under my resources documents page, and you have access to this ACEs study, so you're going to complete it for yourself. Please pause here, and then once you have finished completing your ACEs study, continue moving on with the webinar. What evidence suggests is that childhood experiences do influence adulthood. This includes childhood experiences could influence obesity, heart disease, mental health disorders, addiction, likelihood of cancer, likelihood of diabetes, of Alzheimer's disease, suicide completion and suicide attempts, and cognitive impairment. Now we're going to take a look at how this evidence suggests this. What it also says is that individuals with 4 or more ACEs, so answered yes to 4 or more of those questions on the ACE study that you all should be familiar with now, saw significantly increased risks in the above adult experiences. Individuals that saw 6 or more ACEs, so again, that said yes to 6 or more of those adverse childhood experiences on the survey, saw a 20-year decrease in life expectancy than those that had no ACEs. 20-year decrease. The other findings that the ACEs study showed up, right? The other things that we uncovered. Individuals with 4 or more ACEs were 7 times more likely to abuse alcohol, 2 times more likely to smoke cigarettes, and 6 times more likely to have sex before the age of 15. We also know that 51% of children with ACEs scores of 4 or higher had learning and behavior problems in school. And get this, compared with only 3% of children with an ACE score of 0. Wow. It also, the study suggests that individuals with 4 or more ACEs were 2 times as likely to have cancer or heart disease and 12 times more likely to attempt suicide. 12 times more likely than individuals with an ACE score of 0. What was found with individuals who had 6 or more ACEs, so specifically men with 6 or more ACEs, were 46 times more likely to have injected drugs than men with no history of ACEs. 46 times more likely. And I wanted to pull up this bar graph of what it looks like with ACEs and chronic depression. So you'll see the way that this is described, the orange bar graph on the left is women, the pink bar graph on the right is men. And on the left-hand side of this graph is the percent with a lifetime history of depression as compared to their ACEs score. So individuals who had an ACE score of 0, so no adverse childhood experiences, about 18% of women have chronic depression and just over 10% of men. And you can see how this gets higher and higher with the more ACEs. Almost 60% of women with 4 or more ACEs have experienced chronic depression. And it's about 35% of men. So over a third of men with 4 or more ACEs experience chronic depression. And this is what it looks like for smokers, right? The percent who are smoking. With an ACEs score of 0, it's about just under 6% of the population, right? With 6 or more, it jumps to 16% of the population. And what's important to note is that the original ACEs study was not culturally responsive. It was done through Kaiser, and it was specific with Kaiser clients, so people that had health insurance through Kaiser. So most individuals it was predominantly white individuals that were middle to upper class. So what was discovered is that, and what recent data shows, because between 2011 and 2012, a new ACEs study was put out and was published, the information was published, is that when individuals have adverse experiences by ethnicity, we continue to see more Black and Brown communities have more adverse experiences. All right. So if you see the graph, the bar graph on your left, that's 0 adverse experiences. About 55% of white individuals said that they have not experienced any adverse childhood experiences. And that goes down to 37% Black people that identify as Black and 42% people that identified as Hispanic. When you get to the higher numbers, you'll see the greater than 2 adverse childhood experiences. White individuals, that drops down to 21%. And Black and Brown individuals, those numbers continue to grow. And then what types of adverse experiences? Because again, what the survey asks is a variety of different adverse experiences. It goes over financial hardship, parental divorce, parents served in jail, domestic violence, victim or witness of violence, household member with mental illness, and drug or alcohol problem. So take a minute, this is what the recent data shows, to see the discrepancies between each area or type of adverse experiences based on race. We know that there's other traumatic experiences. There's abandonment, the death or loss of a loved one, life-threatening violence within a caregiver, automobile accidents or other serious accidents, bullying, and life-threatening health situations or painful medical procedures. Right, so all of this are other traumatic experiences that were not asked in the ACEs study. Witnessing violence or police activity, incarcerated relatives, so maybe not a parent, but another relative that you're close with, life-threatening natural disasters, acts or threats of terrorism. So again, other traumatic experiences that are not addressed in the ACEs study. If we put this slide together with the previous slide, it's possible we would have individuals that had even higher ACEs numbers or more individuals that have experienced ACEs. We know that ACEs are common among Washington adults, which means that the adults that have been surveyed have been impacted by adverse childhood experiences. 62% of adults living in Washington have at least one ACE category. 26% have 3 or more, and 5% have 6 or more. If we put that into a Washington State classroom, this is essentially what the classroom would look like. I'm going to break this down for you. This is an average classroom in Washington State of 30 students, although it looks a little different now with COVID. We don't have as many students in our classroom. Of that 30 students, only 6 of those students have no adverse childhood experience. We can assume about 5 have 1. 6 of those students have 2 adverse childhood experiences. 3 of those students have about 3. 7 of those students have about 4 or 5 ACEs, and 3 of your students have 6 or more ACEs that they are being impacted by. Out of a class of 30, only 17 of those students have had no exposure to physical abuse or domestic violence. Nine of those students have been exposed to physical abuse to physical abuse or domestic violence. And 4 of these students have been exposed to both physical abuse and domestic violence. Wow. Our students are impacted by a lot in the classroom. And the layer of the COVID pandemic just adds on to this experience, to this trauma, to what's going on in the home. We know that the effects of ACEs can last a lifetime. That's what the data says. That's what the data tells us. But the effects don't have to. There is work that we can do to support our youth so that these effects do not last a lifetime. It's important to remember that ACEs influence behavior. The more ACEs you have, the more impact on your behavior. There are long-term consequences. There can be significant long-term consequences to your body, mind, your overall well-being. And ACEs are common, right? Almost half, so about 7,000 adults of the 14,000 studied reported abuse. It's important to remember that adverse childhood experiences happen even in the best of families. It's really important not to put our own biases of family, of what family is supposed to look like, into play, because ACEs can happen to everybody, and they do happen to everybody. ACEs affects an individual physiologically, their body, and neurologically, their brain. And we'll get into that. But first, we're going to watch a short video by Dr. Nadine Burke-Harris, really looking at how this ACEs study, how childhood trauma can impact an individual throughout the course of their entire life.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or a packaging chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California, and together we opened a clinic in Bayview Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, "Dr. Burke, have you seen this?" In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand better than we ever have before how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms using best practices, including home visits, care coordination, mental health care, nutrition, holistic interventions, and yes, medication when necessary. But we also educate parents about the impact of ACEs and toxic stress the same way you would for covering electrical outlets or lead poisoning. And we tailor the care of our asthmatics and our diabetics in a way that recognizes that they may need more aggressive treatment given the changes to their hormonal and immune systems. So the other thing that happens when you understand this science is that you want to shout it from the rooftops, because this isn't just an issue for kids in Bayview. I figured the minute that everybody else heard about this, it would be routine screening, multidisciplinary treatment teams, and it would be a race to the most effective clinical treatment protocols. Yeah, that did not happen. And that was a huge learning for me. What I had thought of as simply best clinical practice, I now understand to be a movement. In the words of Dr. Robert Bloch, the former president of the American Academy of Pediatrics, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. And for a lot of people, that's a terrifying prospect. The scope and scale of the problem seems so large that it feels overwhelming to think about how we might approach it. But for me, that's actually where the hope lies. Because when we have the right framework, when we recognize this to be a public health crisis, then we can begin to use the right toolkit to come up with solutions. From tobacco to lead poisoning to HIV/AIDS, the United States actually has quite a strong track record with addressing public health problems. But replicating those successes with ACEs and toxic stress is going to take determination and commitment. And when I look at what our nation's response has been so far, I wonder, why haven't we taken this more seriously? You know, at first, I thought that we marginalized the issue because it doesn't apply to us, right? That's an issue for those kids in those neighborhoods, which is weird because the data doesn't bear that out. The original ACEs study was done in a population that was 70% Caucasian, 70% college educated. But then, the more I talk to folks, I'm beginning to think that maybe I had it completely backwards. If I were to ask how many people in this room grew up with a family member who suffered from mental illness, I bet a few hands would go up. And then if I were to ask how many folks had a parent who maybe drank too much, or who really believed that if you spare the rod, you spoil the child, I bet a few more hands would go up. Even in this room, this is an issue that touches many of us. And I'm beginning to believe that we marginalize the issue because it does apply to us. Maybe it's easier to see in other zip codes because we don't want to look at it. We'd rather be sick. Fortunately, scientific advances and, frankly, economic realities make that option less viable every day. The science is clear. Early adversity dramatically affects health across a lifetime. Today, we are beginning to understand how to interrupt the progression from early adversity to disease and early death. And 30 years from now, the child who has a high ACE score and whose behavioral symptoms go unrecognized, whose asthma management is not connected, and who goes on to develop high blood pressure and early heart disease or cancer will be just as anomalous as a 6-month mortality from HIV/AIDS. People will look at that situation and say, what the heck happened there? This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real, and this is all of us. I believe that we are the movement. Thank you.
She is so inspiring. I love her TED Talk. Definitely is worth the 16 minutes to watch. And I highly suggest you send this TED Talk to other people who need to and are interested in learning more about the ACEs study. So chronic trauma or toxic stress in the brain. So how do these ACEs impact our brain? We know that with chronic trauma or toxic stress is excessive and repeated stress, is chaotic, is unpredictable. It causes disruption to our brain architecture. So it actually causes disruption to our brain development. It impairs our cell growth. It impacts the way that our cells grow naturally. And it interferes with healthy neural circuits. And so that's in our brain again, how these neural circuits are messaging each other. What this looks like on the body. So to begin, we're going to watch another video of this called Flipping One's Lid. And so really how this impacts, if you think about your hand as though it is your brain, right? And so you put your thumb inside and then you put the rest of your fingers down over your thumb, right? All of these fingers over your thumb is your prefrontal cortex. That's that part of the brain that's responsible for your rational decision making, that thinking part of the brain. Underneath your prefrontal cortex is the area of your brain that holds the big emotions, right? Your anger, your fear. It's that limbic system of the brain. Also, underneath this prefrontal cortex, right, is that back part of your brain, that reptilian brain, right? That's that fight, flight, or freeze. And so we're going to watch a video of Dr. Siegel presenting a hand model of the brain and that flipping the lid. What does that mean? What does that look like?
One of the most rewarding experiences for me has been to study brain science and apply it to the experience of parenting. And the hand model of the brain that I use to teach parents is very useful to understand that. So if you take your thumb and put it in the middle of your palm, put your fingers over the top, this is a very useful model of the brain. And when we can actually see in front of us what's going on in the brain, then we can change what the brain does. So let me walk you through very basically what happens in this brain and the structures in it. And it goes like this. The spinal cord comes up representing the wrist, and then you have coming up into the skull the brain stem and the limbic area, which work together to help regulate arousal and your emotions and the way you have a fight, flight, freeze response. These are below the cortex, the limbic and brainstem areas, and the cortex is this higher part of the brain that allows us to perceive the outside world, to think and reason. And this frontmost part of the brain, right behind your forehead, so the person's oriented like this, is actually the part that regulates the subcortical, limbic, and brainstem areas. This regulation is very important because sometimes we can have all sorts of things happen in our life. We're tired, we're exhausted, someone pushes a particular emotional button, and we can flip our lids. So rather than being tuned in and connected and balanced and flexible, we can lose all of that flexibility, even lose moral reasoning, and act in ways that are terrifying to others, including our children. Now, you can actually bring yourself back online and come back to the high road and make a repair with your child, and that's important to explain to them. And you can also use this hand model of the brain to explain to children, even as young as 5 and 6, how to understand when their emotions are rising up from the brainstem and limbic areas here, and how it's overriding the prefrontal area and making it so they may be about to flip their lids. So I've had kids come tell me that they're about to go flip their lids and they need a break. They need a timeout. And by even just naming that, they can tame it. And that's the power of using the hand model for ourselves and our children to help us all make sense of what goes on in the emotional communication that we have in the course of day-to-day life.
And if you watched the webinar video last week, the one on behavior, mental health, and the function of behavior, you remember that one of the last videos we watched was on Name It to Tame It, which is exactly what Dr. Siegel is referencing at the end of this video as well. So again, this is that vision, that visual of the brain, right? We have this reptilian brain down here, which is responsible for our fight, flight, or freeze. The limbic brain in the middle part of the brain, responsible for emotions, our feelings, really starts to trigger and get activated during puberty. And then this neocortex, or rational, or the thinking brain. And of course, that neocortex holds our prefrontal lobes, which is responsible for our impulse control, for our problem solving skills, making sound decisions. When we are living in this reptilian brain, which is the brain that we are living in when we are in toxic stress or trauma, living in a traumatic situation, our prefrontal lobe is getting shut down. It's not actually developing. Those neural pathways are not developing as they should because we are not engaging in those prefrontal lobes to have them fired to develop those neural pathways. So I want you to consider the survival brain, this fight, flight, and freeze, or flight, fight, and freeze as it is written in front of you. And I want you to pause this video recording and take some time to determine, what has this looked like for the youth that you work with? How have you seen this? And when you are ready to move on, feel free to move on. I am going to continue with the slideshow, and please continue when you are ready. And so again, I just wanted to show this visual. On the left-hand side is a healthy child's brain with the temporal lobes fully activating. And on the right-hand side is an abused brain, where you can see that those temporal lobes are not activating. So this flow chart is really looking at how our brains develop to fit the life that we live in. When we are born, it is neutral, right? Brains adapt to their experience. So in that very first shape, that predictable patterns, we know that the way our brain develops is through that electrical and chemical functioning, right? Through brain mass and through gene expression. Now, if we enter into a toxic context, so as our brain is developing, we are in a toxic setting, we might develop characteristics and traits like being overly competitive, being hyper vigilant, maybe hyper reactive, maybe overly focused. It's really hard to shift gears, we perseverate. Or we might be overly withdrawn, emotionally detached, completely numb. This works for us because under the worst conditions, we need to survive. And over evolution, over time, this is how our brain has learned to survive. That goes right back to fight, flight, or freeze. Now, in contrast to that, if we are in a protective context, which means that we are raised in a family with minimal to no ACEs, our characteristics and our traits look different. We're more laid back. We're relationship oriented. We want to build relationships. We're reflective on our own behavior. We seize opportunity. We're open to shifting gears more easily. It's easy for us to shift focus. And it's about the process of the situation rather than the power. And this works because we know, and the way that we have evolved, when we are in a healthy setting, when we are not impacted by significant trauma, we need cooperative relationships because we can live peacefully with others and cooperatively and still survive. When we talk about toxic stress and being hardwired into the body, this is what this can look like, right? For prenatal, it could be potentially a premature birth, a fetal death, postpartum depression, attachment challenges, reduced brain mass for the infant, for the fetus, difficult to soothe, maybe some stress and hormone deregulation, and relationship challenges. Early childhood, toxic stress being hardwired into the body can impact emotional reactions, verbal memory, spatial memory, judgment, self-monitoring, and self-awareness, and it can even impact motivation. For middle childhood, it can be challenging to have that right-left brain communication, challenging to understand social cues, having insight. Movement can be impacted, language, math, memory can be impacted. And then that adolescence age, where we see attention problems, long-term memory difficulties, mental health challenges, a struggle with goal-oriented actions, struggle with regulating movements through the environment. And then on the body, we know that people can feel their trauma, right? Children come to us with headaches, with digestive problems, pain in their body, altered patterns of sleeping and eating, altered vision and hearing, maybe compulsive self-harm, and attempts to self-medicate with substances. So this is how trauma impacts the body. And all of these are attached, are connected to each other. And then on the brain, right, we know that we see when children are impacted by trauma, an increase of anxiety, of restlessness, lack of motivation, right, that might be hardwired in, irritability and anger, right, and the decreased capacity for joy. And then on behavior, right, all of these like fight, flight, or freeze responses, maybe angry outbursts, diminished capacity for empathy, right, traumatic stress takes over the core identity. And this slide was provided through Federal Way Public Schools, this information. Sometimes we perceive traumatized children through labels, right? Oppositional, rebellious, unmotivated. But perceiving them that way not only impacts the relationship we have with them, but also how we support and work with them. We also know that these are the most common psychiatric diagnoses in order of frequency: separation anxiety disorder, oppositional defiant disorder. We may have phobic disorders, PTSD, and ADHD. How many children in the classroom are diagnosed with ADHD when it's actually trauma? And this is what adverse childhood experiences shows us of those consequences of unresolved trauma. So for your activity today, and you're going to have plenty of time to do this, you are able to just pause me whenever you want to do it. These documents are in your resources folder that you have access to through my website. And what I want you to do is I want you to read through the activities. And you'll see each activity then has a background. And I want you to complete this worksheet. So staff perspective without considering trauma, student perspective, and then staff perspective with trauma glasses on, right, through that traumatic lens. There are 2 of these activities. The first one is Maria. Second one is Jamie. Again, Jamie's scenario is set up the same way. Read the first activity, read the first scenario, read the background information, and then complete the document for him. Some additional tips for you. Make sure to take deep breaths yourself to calm down. When you do that, oftentimes students will imitate us. So as you're doing it, your students will too. Slow yourself down, right? Talk slower. Use a lower pitch for your voice. Don't use complex sentences and don't use a lot of body movements when you're talking to a student that is impacted by trauma and is escalating. Offer suggestions on self-calming techniques and participate with the student. Teach positive self-talk. Use it with yourself and with the student. Be a thermostat, not a thermometer. Really, what this means is gauge where everybody is in the room and don't be raising the temperature, but really be making sure that it stays calm, cool, and collected. Use music, right? Exercise, movement, stretching. The more physical activity, the better for kiddos. Avoid taking away recess. And lastly, make sure you are incorporating plenty of opportunity for humor and for laughter. Laughter actually reduces the traumatic response in the brain. Thank you so much. Again, my name is Tova Fairshot. I work out of Washington State and across Washington State through my behavioral consulting and education consulting company. Again, if you still need access to the resources, please log on to my website, innovativebehaviors.org. Click on the resources tab on top. And once you get to the resources page, slide down a little bit and you'll see a link to resources button. Click on that and you will have access to all of these resources. If you have any questions, please don't hesitate to email me. I am always available. Thank you.